We spent some time with Austin Sanders. Tell me the kind of kid he was, how much he weighed, and the health that he was in when he first presented to you.
When he first came to me, he weighed almost 300 pounds. He was depressed. He had some issues with being bullied at school and was really avoiding school. And we've really made some great lifestyle changes for him, and he's really done it himself, and it's really just changed his life.
The biggest change being the low-carb diet.
The biggest change has been really changing his diet, and a lot of times parents don't understand the effect that carbohydrates have on their weight, and most people are taught that fat is really what they need to avoid, and they tried to do that and were unsuccessful. So we placed him on a low-carb diet where he was allowed to eat as much as he wanted. It was just cutting out the carbs, eating more meats, more vegetables, more salads, and he's just done terrific, and he's lost almost 100 pounds.
Mm-hmm. There's not a consensus in the medical community of whether the low-carb diet is the right approach for these, but you can't really argue the impact that this has had on Austin.
No question, it's changed his life. With it, he's healthier, he's self-esteem better, which is really the biggest thing for teenagers is self-esteem issues, depression, those types of things. In general, the medical community, low-carb lifestyle is becoming more and more mainstream. All the studies and the research shows that it's a better way to lose weight. It's much more effective, and you have better effects on your heart and lipid profiles. With it. It's just getting the medical community actually to get on board with it.
And their objections are, I don't want to get into objections and that sort of thing, but it is that it's not as healthy, right?
Many people believe intuitively that if you're eating a high-fat diet, it would be bad for your heart. Unfortunately, none of the studies really confirm this, and it's actually more related to carbohydrates and insulin. That's really what's bad for your heart. And so most people on a low-carb diet have better improvements in actually lipid profiles and blood pressure, blood sugar. They lose more weight, they feel better. So it's healthy for most everyone. It's not for everybody, but 99% of the patients do better on a low-carb diet.
So that's a message. It's not for everybody. It's dependent upon what your situation is.
Absolutely, but it's in general, it's the most effective way and the safest way to lose weight.
Mm-hmm. And in Austin's case, it's also been not a very difficult way. He still is. Those are the kinds of foods he enjoys anyway.
What I find with kids, that's one of the biggest reasons it's successful. When it's easier to follow, we see better results with it in kids that are following a low-carb lifestyle. They just seem to do better, and they're much more successful. Plus, they see that they see weight loss. Oftentimes on low-fat diets, kids are not successful losing weight, so they get frustrated and they give up. With this, they see tremendous results, and they're able to continue it.
So his not. Obviously, when you look at him, he looks totally different. But his health is also considerably better.
Absolutely, probably the most important is his mental health, his self-esteem, but also his lipid profiles are better, his blood pressure is better, his blood sugars are better, which goes along with everything that you see with improvements with the weight loss.
And he was talking about thinking, he was considering suicide at a point, and now he's looking toward his future, and he's got goals and he's got plans, and there are things he wants to do.
Yeah. Oftentimes parents don't understand how depressed kids can be when they're overweight, and so it is real important to address those issues as well, and not just the weight itself, but in doing that with a comprehensive program that allows for exercise, for weight loss, and just doing it the right way. Many people try and they're just not successful because they're following the government's guidelines on low-fat diets, and they just don't work.
What other advice would you give to parents? It's not something to sweep under the rug. What should be their first step for seeking help for their kids?
Well, I think it's just education and knowing what the best way is to lose weight. And it's really not about watching fat intake or calories. It's really more about carbohydrates. And if you learn to do that and pay attention to how many carbs you're actually getting, it adds up very quickly, and you realize what the effect that the carbs have on the weight as opposed to fat.
Is that something they should try on their own, or should they see a doctor and get it?
I think it'd be a good idea to get started with a physician that is familiar with low-carb diets, if they certainly are concerned about their weight. With it, there's several other things you have to look at: is how tall they are, making sure we don't have any other medical causes of obesity as well.